Welcome to Startup Health TV. This is Logan Plaster, editor of Startup Health Magazine. This is a special COVID-19 health innovation update, and I'm joined today by Imran Cronk, CEO and founder of Ride Health. Imran, thanks for taking a few minutes to let me know what you're working on.
Yeah, thanks for having me, Logan, and thanks for everything that you and Startup Health is doing during this time.
So what we're doing with these updates is we're listening to founders about how they are pivoting or refocusing their work on the COVID-19 outbreak. I understand Ride Health. We've called you in the past an Uber for hospital transportation. I know that you help manage rides for populations that would otherwise have difficulty getting to the hospital, whether that's for financial reasons or geography or physical limitations. You help them get to the hospital and you help arrange payment, which I think is a really interesting model. But I understand that you really are refocusing those efforts on COVID-19. You've got contracts in New York City, right there in the middle of it. So paint me a picture. Tell me what you're working on.
Yeah, absolutely. So, as you said, we help healthcare organizations from hospitals to health plans make sense of the world of mobility, building or strengthening existing enterprise transportation programs to help those vulnerable populations access care. And so we operate at the intersection of several impacted stakeholders, immune compromised patients who need access to life-sustaining care. Across the country, hospitals and public health officials are calling for the cancellation or postponement of non-emergency care or routine care. The other way to look at it is for people experiencing cancer or who are on dialysis treatment, non-emergency is a bit of a misnomer. With chronic disease, it's more like a succession of constant emergencies, right?
Yeah.
And so it's difficult and challenging to think about and help patients navigate these trade-offs.
Can you give me an example? You're talking about cancer and chronic disease, these progressions of emergencies. Talk to me about a patient that Ride Health might work with for whom these orders about decreasing appointments and surgeries is actually becoming a life-threatening situation.
Yeah, absolutely. So when you think about patients experiencing cancer and radiation therapy treatment, which is often day to day, it's daily treatment. The evidence is that missing just 2 radiation therapy treatments during a course, which might last a month or more, actually has a material impact on 5-year survival rates, just missing 2 of those treatments. So when you think about patients and their care teams who are having to make these wrenching decisions about radiation therapy, along with chemotherapy and surgery, it's a really challenging environment for patients experiencing cancer right now that will have a material impact on their mortality. But on the other side, you're dealing with immune suppressed patients, right? And the risk of them being out in the world at this point in time. And so how do you even think about that trade-off? It's really, really challenging. So there's that side, which is the patients and immune compromised in the middle of chronic disease treatments. But then there's drivers and all of our transportation providers. And the challenges they're experiencing range from anxiety related to their own risk of contracting COVID-19 as they come into contact with many different folks throughout the day. But also for transportation company owners, they're seeing a precipitous drop in demand for non-emergency transportation services. They're having trouble just staying open, let alone keeping the drivers they still have safe. So it's a really challenging supply environment in addition to demand. And then you think about the places that these drivers and passengers are going to or from, the hospital facilities. They are on all hands on deck mode. They are stressed out. And so when you think about just the mixture of all 3 of these different stakeholders, we're kind of in the middle, helping them all connect and make sense of what's going on in a small way. There's obviously 100 different challenges in the system aside from transportation, but it is one critical piece. And so
how are
for
you addressing
COVID-19,
each of those 3 pieces? How are you
yeah,
tackling them?
so for COVID-19, we're focused on 3 priorities. The first one is to preserve access to life-sustaining treatments, including chemotherapy and radiation therapy, by working with health system and health plan partners to ensure that we can provide safe transportation for patients in those circumstances. The second priority is helping hospital facilities connect to a supply of COVID-equipped transportation providers. These are providers who are prepared to handle COVID at-risk patients. And the really interesting impact is that you're helping to free up bed space through these discharges and transfers out of hospitals and to other hospitals that may have more capacity. You see that in areas like New York, where a lot of the downstate hospitals are getting severely capacity constrained, and there may be hospitals in less populated areas that are in a different circumstance. The same is now playing out across the country. You see hotspots develop in places like Detroit, Chicago, New Orleans, and so that is becoming an area of increasing focus for these organizations. And then the third priority, go ahead.
Well, how big of a difference, do you have a sense of how big of a difference that transportation mobility element can play in terms of opening up beds? You just said how important it is to be able to discharge away from a hotspot. Are you getting a sense of what kind of impact that can have?
Yeah, at the moment, if you look at what Mount Sinai in New York has reported, 80 to 90% of their current census now at this point, I read over the weekend is related to COVID-19. And so if they're able to take folks who have maybe who have become less critical and less severe and get them into alternative environments for recovery, that gives them more capacity in their ICUs for people who may be still climbing up the hill. And so it's hard to get real-time data, data from everything from testing to what's going on in the hospital, what's going on around our healthcare system as a whole is always operating on some sort of delay. But based on just how stressed out and overcapacity these systems are, everybody is thinking about and now taking steps to actualize more optimal distribution of patients across systems. Our third priority is to send medical professionals and food delivery out to homebound older adults who are on Medicare Advantage plans and children who rely on school lunches and are now at home as well. So we've repurposed our platform to be able to support delivery of physical goods, whereas historically we've always been focused on patient transportation. So that's been interesting for us to learn about very quickly here. Along the lines of product enhancements, the product now includes a COVID at-risk screener during the trip request process. And so that flag now gets taken into account by our fleet engine, which makes decisions about which transportation provider is most appropriate for a ride. And we're now across the country assembling the largest organized network of COVID-equipped transportation providers in the nation to meet the needs of healthcare organizations during this unprecedented time. So normally we do this kind of matching for service levels like wheelchairs and stretcher vans. The same notion applies to COVID-equipped and COVID at-risk transportation.
Yeah, I know our time is short. So pressing on many people's minds is, keeping people and drivers safe in a rideshare situation. So quickly, what are some of the steps you're taking to keep the drivers safe?
Yeah, so from a contractual perspective, transportation providers are adhering to all applicable federal, state, and local laws and regulations, as well as personal protective equipment, PPE standards, in accordance with guidance by their state health departments and CDC. And what that means practically is that they are cleaning and disinfecting their vehicles after each patient transport encounter, and all surfaces that did or might have come into contact with a patient must be thoroughly cleaned, disinfected using an EPA-registered hospital-grade disinfectant in accordance with that product's directions. So we're making sure that our transportation providers are taking those steps if they are doing COVID at-risk transport.
Awesome. Imran, well, thank you for taking a few minutes to give us this update. How can people reach you if they want to collaborate with you?
Our website, ridehealth.com, has a contact form, and my email is imran@ridehealth.com if anyone wants to reach out.
All right. Thank you for your time, and keep up the great work there at Ride Health, Imran.
Thanks, Logan.
All right. Take care.